Civil War medicine has been an interest of mine for as long as I can remember. First time I knew anything about the Civil War, I was 4 years old. I was at Gettysburg in August, and I was in shorts, and had the great idea of sitting on a cannon. I walked kind of funny for a few days after that. This talk actually started for me around 2005, 2006. I was a member of the Madison, Indiana Civil War Roundtable at a church out in Indiana. And every year we would have a banquet. And this one year, Bud Robertson was our speaker. Now, Bud Robertson was a graduate of Virginia Tech, a professor at Virginia Tech, and wrote the biography on Stonewall Jackson and the biography on A.P. Hill, two Confederate generals. He spoke on all the advances during the Civil War of which medicine was a part. And that just kind of got me thinking. I was in the National Guard. I was a medic from 71 to 77. And it just got me thinking about that. So I've been working on this off and on for a number of years. I totally grossed out our mail person one time, because she would ask me, because I'd get books from Amazon, and she asked me the titles of the books, and you know, most of them were okay, but there was one that had the word gangrene in it, and she never asked me the title of another one of the books. But this, we're going to go through this material. I told Kara, I said, I actually had enough material to do an entire semester's course. The books you have in the annotated bibliography there, if you read all those books, you will know everything there is to know about medicine in the Civil War. You absolutely will. So let's get started. We're going to look at advances in surgical technique, advances in transportation, advances in care of the patient, treatment of disease, and then we'll finish with the Gettysburg case study. Lost my clicker already. If you were wounded on the battlefield in 1861 at the Battle of First Manassas if you were a Southerner, or First Bull Run if you were a Yankee, this is what you faced. There were no dedicated ambulances. Ambulance wagons were controlled by the Quartermaster Corps, and first priority was to carry supplies, not the wounded. Confederate ambulances were never more than unsprung wagons. Imagine. Band members, cooks, other non-combatants, that's one of a couple typos are on there, served as bearers for the wounded. They were untrained, and the litters were usually nothing more than a blanket carry, which is not very stable. Rescue from the field often took 1 to 3 days or more. There were still wounded on the field at Manassas 5 days after the battle. If you got to a field hospital, the wounded for the most part were treated as they came. There seemed to be no priority being taken care of other than men from the surgeon's unit were seen first, no matter the severity of the wound. And in a Confederate field hospital, the Yankees were seen last, and vice versa. The surgeons had little or no training in what we know now as trauma surgery or trauma treatment. And surgery often was amputation. There was no sense of sterile technique. Thus, if you survived the surgery, infection would often cause your death. Most of the doctors early on were the family doctors who went to war with the boys. In some cases, boys that they had actually birthed. Now, the average family doctor in the average small town maybe saw 1 or 2 or 3 gunshots in their entire career. Now, they're faced in a regiment of maybe 150. And the caliber is bigger than the hunting rifles, and most of them didn't last very long and left and went back home. Many of them were in 90-day regiments anyway, and they didn't come back. one of the advances we'll talk about on through is how the training of the doctors really did improve, and thus it really improved the survival rate. To give you a statistic in regard to surviving the surgery, 70% of the amputations at First Manassas, first Bull Run, died of infection. 73%. Within 2 months, 73% of them were dead. I promise you that that improved. Causes of battle wounds. The various caliber of mini balls caused approximately 75% of all wounds in the Civil War. It is an especially heavy projectile that smashed bones and destroyed organs. I'm going to pass around a .58 caliber mini ball, and you can get the heft of it. And I'm also passing around one that killed someone. And you see it flattened, it shattered bone and it flattened. You might want to pass that one around real quick. Put your hand out, Mary. You can pass them around. All these up here are .44 caliber, which was the standard pretty much. It went .44, .58, and there were .69 caliber pieces, which really was very, very heavy duty and very, very nasty. Artillery fire caused 23% of all wounds. Solid shot, shell, grape shot, and canister were the big four. Concussive explosions were especially effective, where the shrapnel really just didn't even have to hit you. It was just a blast injury. And most of the shrapnel was fired overhead, and the shell would explode overhead and rain the shrapnel down on the troops. There's a scene in the movie Gettysburg where the Confederates on Pickett's charge, double canister is fired into their company and it kills the entire company. This was very standard. Now, Hollywood would have you believe that saber charges and bayonet charges were done all the time, and so many casualties occurred with saber and bayonet wounds. 2%, actually less than 2%, were covered by bayonet and saber. But again, you watch Hollywood movies, and yes, Chamberlain did order a bayonet charge down the slope at Round Top. No Confederate soldier was killed by that bayonet charge. They saw the bayonets coming and they surrendered or ran. No one was actually killed or wounded. This gives a scene early on of the hospitals. You can see that the wagons are just basically freight wagons. It is chaotic. You can see, whoops, sorry. The number of wounded in the back that are waiting. The typical surgery, probably administering ether or chloroform. Early in the war, it was ether. If they didn't have ether, bourbon would do. The bucket was used to clean off the surgical site. Didn't do a good job. The surgeons, because there was no sterile technique, they would wash in the same water that they had washed in maybe 15, 20 times before. So it was pretty horrid. The middle picture is of an amputation. It's an amputation of an arm. I keep hitting the wrong button. I'm sorry. I'm not used to this. It's an amputation of an arm. It's just getting prepared. Please note, everybody around here, we're so conscious about masks now. No surgeon in the Civil War ever wore a mask. They didn't exist. So, infections. Picture over here is of one of the hospitals in Fredericksburg. And these are the ones who have already been operated on, who have already been taken care of. And there are a couple female nurses, which in December of 1862 was very rare. Anybody know what this is? What is it? Scarifier. A scarifier. A scarifier was actually pretty much invented by Benjamin Rush in Philadelphia at Pennsylvania Hospital. And the idea was to do a bleeding, to get rid of the bad humors in the body, the bad blood. George Washington probably did not die of pneumonia, he probably died from being overbled, which was not uncommon. A scarifier is spring-loaded. Inside there are anywhere between 6 and 15 blades that you hit the trigger and they dig in and you bleed. By 1862, heroic medicine measures, as they were called, the bleeding, etc., was gone. Poultices and that kind of stuff was still happening, and they still thought disease was caused by miasmas, bad air. And that went right through the end of the war. But the scarifier was only used early on in the war. I'm going to skip the next one because it explains what I just explained. Except there's a surgical instrument set. And we have one in the back that's part of our permanent exhibit. And I will tell you, having been a medic, the basic surgical instrument set from 71 to 77 looks very similar to what was used in the Civil War. The sutures were obviously sterile and things like that, but the tools, I have to tell a story on that. I'll go back to that one. Our pediatrician in Camp Hill, who will go nameless, and it's been many, many years ago, was harassing an orthopedic surgeon one day. He said, "You guys that are orthopedic surgeons, you're just carpenters." And the tools aren't that different, quite frankly. So at tax time, the orthopedic surgeon sent him a copy of his tax return. And over the top of the tax return, it said, "Not bad wages for a carpenter, huh?" And the pediatrician said it was 9 times what he made. So he said he didn't say anything after that. Field hospitals, usually in tents located near the battlefields, were the scene of most surgeries. Ambulance wagons, stretchers brought the wounded to the hospitals. Now, keep in mind, this was starting in 1862, the end of 1862. Those shot in the head or abdomen were likely to die and sometimes were left untreated. Limb wounds were survivable, although the limbs typically had to be amputated. The Confederate Manual of Military Surgery provided detailed instructions for amputations. I had a copy of that diagram and I decided not to include it. Just thought. Most surgeons quickly gained extensive personal experience with amputation. And the next picture will show the saw below was typical of those used in field hospitals. While patients survived the surgery lacking knowledge of the importance of sanitation meant many amputees died from gangrene or other infections in the weeks and months following surgery. Now, this is a more complex surgical kit. Would have been used in a field hospital. And while I can't demonstrate an amputation today because they won't unlock the surgical kit back there, I do want to talk about amputation. You all ate, right? You're all okay? Soldier is brought in, let's say he has a lower leg wound, mini ball. A lot of damage. The surgeon will immediately, first of all, he's probably treated at an aid station to begin with and bandaged and maybe given morphine or laudanum or alcohol. He's brought to the field hospital, which isn't that terribly far away. The surgeon, first thing he will do is look at the wound. The next thing he will do is put on the tourniquet. Every surgical set had at least one, some surgical sets had 3 or 4. He would stop the bleeding so he could see what was needed. He would then probe for the bullet to see if the bullet was still in the wound. He probed with his bare hands. If he couldn't find it, he would take a knife, or later sets actually had a surgical probe. This probably could be used as a surgical probe already, as could this. These are surgical probes. And he would go in and he would tap around, and when he hit bone, or hit the bullet would respond with a metallic sound, and he knew where the bullet was. He then would, if he felt that he could remove the bullet and bandage without amputation, that is what he did. If the damage was too severe, if it was what we now call an open fracture, where the bone is in many, many parts, the only treatment ultimately was amputation. So, he would be chloroformed or ethered. The preference was chloroform. Ether took longer for the patient to go under. Ether was more unstable, and ether was flammable. Some of the surgeons actually operated smoking cigars. You really don't want to use ether. Just saying. Chloroform works really well. There were still deaths from over-chloroforming, but chloroform was the one of choice. There's only been found 7 or 8 bullets that have human bite marks in, if they didn't have anything else. Hollywood would have you bite the bullet for every wound. What would happen next is he again would examine the wound, and he would decide where to make his first cuts. He would use one of the knives to do the skin incision and to do the muscle incision. And he would make, when he got down to the bone, he would save the muscle and the skin as a flap. And he would pull the flap back, and then he would use the saw, which was a glorified hacksaw, quite frankly, and he would cut off the bone. He would then smooth the edges with the various tools. He also had a sanding block, which that's what that is, and he would smooth the edges of the bone that was left. He would then take the flap, and he would put it over the wound, and he would sew the flap back on. And it was still connected to one end, but it was like a U-shaped flap. And he would sew it back on. And would usually put in, if he had a piece of hose or whatever, he would put in a little piece of hose. If he didn't have that, he would just let it open so it would drain. Before that I forgot the most important thing. He would ligate, he would close the arteries and the veins, and then open up the tourniquet to make sure he got them all. At that point, the wound would be covered with plaster of Paris and gauze, and he would be taken off the table, and the next soldier was put on the table. Now, it took me about 9 minutes to describe all that. A good surgeon by 1864 could do an amputation in 5 minutes of a leg or an arm. 5 minutes. That's from chloroforming to closure. They had to do it. There were too many wounded. Any questions on that? I still have all of you. You haven't passed out.
Did they attempt to clean the saw when you attempt, or just dip it in the...
Dip it in water. Dip it in the bloody water.
Yeah.
Wipe it off. Franklin, Tennessee, was a horrible battle for the Confederates especially. It was a slaughter. I mean, it just was. To the point that the Confederate hospital, which we toured, my wife and I toured, and 5 Confederate generals were laid out on the front porch when they had died. To give you an idea, one of the guys' names was States Rights Gist. He was born in 1823, so that's where it was, you know, they were fostering that already. In the upstairs, in what was one of the surgical suites, there is blood still on the floor. It had stained, and my wife, who was a little squeamish, was with me, and she goes, "Is that what I think it is?" I said, "Yeah, it is." And she said, "Oh, well, that's disgusting." I said, "Yeah, I know." I stood right before it, and the surgeon was wearing an apron, and you could see the outline of the apron with the blood on the floor. And I told Jackie he was right-handed because there was a pool of blood down on the right-hand side. This is a typical field setup. Please note a complete absence of sterile technique, as germ theory was not known until the 1870s. When I had my medical training in 1971 for the Guard, Fort Sam Houston in Texas, in San Antonio, I think we had 14 days about sterile technique. I mean, it was amazing the amount of training we had for that. Here, nah, it's okay. They used towels over and over again. They didn't matter. Now, before I put this next one up, these are mannequins. Okay, these are mannequins. I think that's actually an exhibit at the National Civil War Museum in Harrisburg. Most common amputations were arms and legs as a mini ball, which caused severe trauma. How many amputations were there in the Civil War? About 80,000, which isn't all that terribly many considering all of the wounds. It's not that bad. Surgical knowledge improved the number of full amputations, decreased as surgeons learned how to resection to save the limb. Even with that, amputations at the shoulder or the hip, in other words, closer to the torso, had much less chance of success. That's still the same today. There is one known incident of a finger amputation proving fatal during the surgery. This officer was wounded, shot in the finger. They bandaged it. About a month later, it was really infected, and they decided to amputate. The officer said, "Fine, let's cut it off," and they put him under, and they over-chloroformed him and killed him. That's the one known instance of a finger amputation that we know of that died, and it wasn't the amputation. Okay, this next picture, the left-hand picture is a little gory, but this is the idea that most Union and Confederate soldiers had with the surgeons, and it became a popular view of the people at home, that surgeons were butchers and amputated at will. That is a pile of amputated limbs. There were a few such surgeons early on, but they were removed early on in the war on both sides. Amputations were gruesome and feared but by the Battle of Spotsylvania, Virginia, only 20% of the amputees died from infection, and most made it home. The overall success rate was about 25% that made it home from the war. Gangrene was conquered by the use of bromide to treat the amputation stump. That is a horrible, difficult, burning, miserable treatment, but it saved their lives. Now, the picture on the right. What movie does that come from? And who's that lady right there? Gone with the Wind. So, who's that? That's Scarlett. That's that wonderful scene in the movie where they start in close and they pull way back and you see hundreds of wounded. It's an amazing scene. And actually accurate, where a lot of the other movie parts aren't, but that is. But this is what was faced. I wasn't sure anybody would answer Gone with the Wind and Scarlett O'Hara. Who played Scarlett O'Hara? All right. You guys get an A tonight. The advances were both intentional and accidental. The surgeons learned new techniques by practice. And an amputation could be done in less than 10 minutes routinely, thus providing the patient a better survival rate. The use of chloroform was preferred over ether and was safer. The old ideas of heroic medicine dating back to Benjamin Rush, bleeding and the idea of humors, were discarded. And an accidental positive outcome occurred in the South, when silk and cotton suture material were scarce. Horse manes were shaved off, and the hair boiled to make it pliable to be used as a suture. The boiling sterilized the hair, and infections of the wounds dropped dramatically. That's one of the accidentals. One of the Confederate surgeons, about 10 years later, after germ theory had come out through Louis Pasteur, wrote, "Wow, we were doing something, we didn't realize how good of a thing we were actually doing. We were just doing it to get suture material." Now, one of the advances, first of all, let's show you that picture. Can illustrate the scene found around a forward aid station or field hospital. How does one sort out the wounded for treatment? Early on, regimental surgeons treated their own, but that was a failure. In a reorganization led by Jonathan Letterman, and I will do a little more with Jonathan Letterman because he was so important. He instituted the concept of triage, still in use today in every emergency room in the nation when decisions have to be made about treatment. These apply to traumatic injury and disease. There are three basic categories of wounds or disease. A minor wound or illness can wait. There's no chance of mortality. Lowest priority, can be treated as time is found. A hand or finger wound or a mini ball grazing, or he falls and sprains his ankle, something like that. They're not life-threatening. This is why if you go into an emergency room for something kind of minor, you sit longer. If you go in with a heart attack, you go right in. That's the whole concept of triage. An obviously mortal wound in the Civil War was often an abdominal wound or a severe head wound, or multiple severe wounds. The person was made at ease as best as possible and was usually left to die. Palliative care only, which would have been morphine, alcohol, or laudanum, just to so the pain is taken care of. In the Confederacy, there were some who called this the deadline, because they were going to die. And I am writing a Civil War novel, and it's about a Confederate chaplain. And the first thing he sees is First Bull Run. And there's a sergeant who is a very vile, nasty person whose language is horrible, and he doesn't like the chaplain, and the chaplain doesn't like him much, but he's severely wounded and he's supposed to be amputated. And this guy says, I'm not going to be amputated. And the chaplain tries to talk him into it, and the chaplain tells him where to go. Or the sergeant tells the chaplain where to go. He comes back a couple hours later and he's moved over to the dead line and he's dead like 3 hours later. And that's triage. A severe wound that can be surgically treated is first priority. These are where the amputations fit in. They're the highest priority and are treated first. In the ER today, these are coronary strokes, gunshot wounds, traffic accidents, other serious injuries. It seems horrible at first glance, but triage saves the best effort for those most in need. And that's a good definition of triage, and who have the best possibility of survival. Battlefield surgeons today have certainly moved the dial on viability, but the Civil War surgeons, both Union and Confederate, did the best they could for the knowledge they had. It seems to be a given that most medical advances, especially trauma surgery, occurred during times of war. And that was the case in the Civil War, and it's been the case in every other war. Trauma surgery advances in warfare. Any questions on the surgical aspects?
How did they come up with the bromine technique? Is that like something tested and experimented?
There was one surgeon who said we have to do something, and bromine, it was an irritant, a counter irritant, and they thought that maybe they would like cauterize, and in a way that's exactly what bromine does, it cauterizes, which they hadn't even really thought of that at all. And that surgeon then, told other surgeons, and it got to the point. And it was used in most of the hospitals in DC, and it was actually used a little bit briefly at Camp Letterman, toward the end of the Camp Letterman time in Gettysburg. Transportation. This is a photo of a Union Ambulance Corps training, so it's Union Army. This is Jonathan Letterman. He comes on the scene, and he becomes the Chief Medical Officer of the Army of the Potomac during right after the 7 Days battles. I'll talk more about that. But he is responsible for organizing the ambulance corps. There was no ambulance corps. He organizes it by the Battle of Fredericksburg, which, by the way, the diorama on the table is the Battle of Fredericksburg. And yes, I painted all those figures. These are examples of ambulances. Note the two-wheel ambulances. Note the very primitive springing. Note that this really doesn't even have any springs. I cannot repeat what the wounded called these ambulances. Just saying I can't repeat it in mixed company. The Confederate ambulance was a freight wagon, rudimentary springs if at all, and really pretty horrible to be translated if you're wounded in one of those. This is a modified Rosecrans ambulance. 4 wheels, which makes it better. It is sprung, it's fully sprung. And that's General Rosecrans, who wasn't a very good general, but he did design a pretty good ambulance. Union. This is a Rucker ambulance, and this is a photo of the model, which I have over there, which you can take a close look at. That was the most advanced of the ambulances in the Civil War. That was incredibly advanced. And the last is the Rosecrans ambulance that's at the Spangler Farm in Gettysburg. And Dale should recognize that photo. 1861, again, ambulances were under the Quartermaster Corps. Wagon drivers were civilian. They carried freight and officer luggage. At First Manassas, virtually no wagons were used to carry wounded from the field. The wounded were left for as long as 5 days. Stretcher bearers are often those soldiers who were either non-combatants or soldiers deemed unfit for combat. They were untrained in patient transport and often fled the scene without doing their duty. The wounded soldier who was lucky was often helped off the field by one or two able-bodied soldiers taking a friend from the front. But what happens there is you have the wounded soldier and his friend who's not wounded and maybe another friend taking him off the field. So instead of a loss of one, you have a loss of 3 personnel. Very common. Stonewall Jackson is wounded in the Battle of Chancellorsville by his own men. He is carried off the field in a really primitive stretcher. He's dropped 4 times. He is operated on, his arm is amputated. You can actually go to the grave of his arm down in Virginia. And he then dies of pneumonia sometime later. His last words were something to the effect of, let's cross over the stream and rest under the shade of the tree. And before that, he was yelling for A.P. Hill to come up and attack. Jonathan Letterman instituted the Army Medical Corps, specifically developed the Ambulance Corps of trained litter bearers, initial medics, military drivers, dedicated ambulances strictly apart from the Quartermaster Corps. Woe be it to an officer who tried to put his baggage in an ambulance, as it was a court-martial offense. And at the very least, his baggage would be dumped by the side of the road. There is one exception. General Grant, head commander of the entire Union Army, had his desk and had his baggage in a Rucker ambulance. And no one thought to kick him out of that. No one else dared do it. As a result from the Battle of Fredericksburg, which was a horrible Union defeat with over 12,000 Union casualties, almost no wounded were on the battlefield longer than 24 hours, which increased survivability. With our more modern equipment today, the ambulance personnel still react in much the same way, following the same regulations instituted by Letterman. Nothing has really changed. Confederate ambulance service, 1861 to 65. The advances made in the North were not evident in the South. Whoops, did it again. That's a Union ambulance. It's a model of one. That's a model of the Confederate freight wagon. If you had a choice of riding in either one, you would take the Union one for sure. The Confederate ambulance, again, is a freight wagon, unsprung. During the retreat from Gettysburg, the wounded were in so much pain from the jostling that they cried out to be left off the wagon so that they could die by the side of the road in peace. Over 500 wounded left the wagons on the route coming down from Gettysburg. Thankfully, I have to give credit to the people of Adams County, the farmers along the way. They took in an awful lot of these wounded and took care of them. Even if they had come through and looted their places, they still took care of them, which is really a good gesture. The retreat was marked by over 500 cases. Jonathan Letterman and his major improvements to the medical service. What I want to do, I want to read an article to you about Letterman. I think it's a great summary. This is written by a medical officer in the Army just about 2 years ago. In 1862, the Army of the Potomac was ragged in terms of health and fitness. Regular Army soldiers and tens of thousands of new recruits were cobbled together into fighting units that were proving to be ineffective. One key reason for lack of effectiveness was illness and wounds. Major General George McClellan replaced his medical director in July with Major Jonathan Letterman on recommendation of William Hammond, the Surgeon General. Letterman found the Army, by the way, Letterman was born in Cannonsburg, went to Jefferson College in Cannonsburg, which is now Washington and Jefferson, which, by the way, destroyed Allegheny College Saturday in football.
Yes.
Had to throw that in. Letterman developed an understanding of problems and later wrote it was critical to support commanding generals by keeping the Army healthy, resilient, and in the fight. The major book I used in preparing this on Letterman was his own journal that I was finally able to find after looking for it for over 20 years. First, Letterman attacked the problem of poor sanitation. Letterman ordered changes to personal and unit hygiene. He required troops to bathe weekly in a river for at least 15 minutes. That's once a week. Wool uniforms. Pits were to be dug for latrines and 6 inches of fresh earth thrown in them each day. When filled within 2 feet, they were completely covered and a new pit was dug. This was a similar approach used for kitchen and animal waste. Letterman's second problem was battlefield organization and logistics of moving wounded soldiers. And we already talked a good bit about that. Letterman moved on to the third issue, medical supply logistics. To ensure supplies go to where they were needed and not lost when brought too far forward, Letterman ordered changes in the medical supply system in October of 1862. His plan makes the brigade surgeon responsible for distribution and accountability. There is a wonderful pharmacology set in the museum in Frederick, the Civil War Medicine Museum in Frederick. It's the best I've ever seen. Letterman ordered that surgical procedures be performed by 3 dedicated physicians per division. Those physicians needed the greatest surgical experience and proven competence. Any physician who wanted to perform surgery was expected to have the technical expertise required for the title of operating surgeon. For the first time ever, specialized surgical skills were required and were recognized for proficiency. 1 medical officer in every field hospital was ordered to keep detailed records on every patient brought to the hospital and the conduct of the surgeons. Pretty amazing for 1862. Many key tenets of Army medicine today can be traced to Jonathan Letterman. And this officer writes, "We place the most skilled surgeons at the forward surgical team. The idea of treating wounded soldiers near the fight so they can return to their units as soon as possible keeps platoons and companies closer to full strength. We evacuate the most seriously wounded to the nearest military medical center with all speed and have multiple echelons of care. We are masters of medical logistics and supply, promoting resilience of soldiers by encouraging proper diet, good sleep habits, and fitness support Army readiness. The origins of all of these concepts come from Jonathan Letterman." Now, Jonathan Letterman was certainly known by Hammond, and he had prior service with McClellan. But even before that, the dean of the medical school at Jefferson College was General George McClellan's father. You want to guess one of the ways there were some strings pulled? But it was like the greatest thing that ever happened for the Union Medical. This man was amazing. He was a genius. And I went over all of that basically with the article. The unfortunate truth of litter bearers and ambulances were captured and crews killed during the battle. He also helped organize the military railroad, a way of transporting patients to military hospitals. He worked with Herman Haupt on that, who was the head of the railroads. And while the wounded were basically just put in boxcars, they were still able to get them to Baltimore, Philadelphia, Harrisburg, Lancaster, York, and some were brought into Carlisle. I talked about the standardization of supplies. And he set up a chain of caring for the wounded, like the aid station that would do initial bandaging and the administration of alcohol and morphine to the wounded. This was also the first step in the triage process. If someone came to the aid station and it was a fatal wound, basically what happened was that they never sent them on. They just kept them there and they died there. Brigade and division hospitals were the norm in the Army of the Potomac by Fredericksburg in December of 1862. These field hospitals were often placed in barns or other structures if possible. This photograph shows the church building. Churches were preferred because they could lay boards across the pews where they would operate or where the patient would rest after surgery. Often these hospitals were within battle lines and surgeons were killed. So the difference between 1861 and 1863 or 1864. A wounded soldier would be removed from the battlefield as soon as possible given tactical conditions. And there were truces to remove wounded from time to time, not always. There he would be treated for pain relief, initial bandaging, and triage would determine where he would go next. If the wound was minor, he was sent back into the line. Major wound, he would be sent by ambulance to a brigade field hospital for further treatment. Brigade or division. There he was examined, prepared for surgery, chloroformed or given ether to put him out, and the surgery would be performed. After bandaging, he was taken to what we today would call a clearing station, where he would be watched in regard to stability. This was at the brigade hospital. He had to face only a 20% chance of infection by this time due to the bromide treatments on the affected limb. If other surgery was required, which is also called a resection, it could be done there, or the patient could be transported to a general hospital in a nearby city. By the way, a second surgery, a second amputation on the same limb had a very poor success rate. In Gettysburg, Letterman Hospital was just east of Gettysburg on Route 30 East. As best as I can determine, and maybe I shouldn't tell you this, but the surgical unit was where the Haas's restaurant is now. As best as I can determine. My wife didn't like to hear that stuff, and we ate at that Haas's one time. And she said, "Was this part of Letterman Hospital?" I said, "Yeah, it was." She goes, "Oh, what part?" And I just said, "You don't want to know." And she goes, "Okay." The goal in treatment was to return the soldier to home where he could eventually be fitted with an artificial limb, some of which were quite advanced for the time. A far cry from 1861. Now, that's treatment of the wounded. Disease. Most men did not die on the battlefield, but in a bed due to disease. Battle deaths and wounds were 110,070 in the Union Army. Disease killed over 250,000. Confederacy, these numbers are shaky. Confederate records weren't very good. The latest I've read, disease took over 200,000. Battle deaths and wounds were 94,000. Now, considering that the South had fewer men of military age, that percentage is much, much, much higher. These are the diseases. Alcoholism, STDs, yellow fever, malaria, dysentery. Look how prevalent dysentery is. Meningitis, typhomalarial fever, remittent fever, which comes from insect bites. These two together are basically a typhus. Typhoid, pneumonia, Measles and mumps. Scarlett O'Hara's first husband goes into the Army, and what does he die of? Measles. And then skin infections. And then the other assorted. 3.2 million soldiers of both sides fought in the Civil War. Disease took the lives of approximately 500,000 soldiers, a rate of death of 15%. In the Mexican War, that rate was 1 in 7, so there were improvements. Almost 6 times as many soldiers died from an amoeba, which is dysentery, over the course of the war than were killed by a bullet in Gettysburg. I just found that to be an amazing statistic. An amoeba killed more than were killed in Gettysburg. Typhoid had the highest rate of mortality. 79,000 cases reported, 29,000 died, 37%. Malaria was also common, but was already being treated by quinine. One of the things that had to be smuggled into the Confederacy was quinine, and quinine vials were hid in the petticoats of the women crossing the border. STDs affected over 200,000 soldiers. Just get that in your mind, 200,000 soldiers. Nashville became just one warehouse, for lack of a better term. Popular slogan of the day was "A night with Venus means a lifetime with Mercury," because Mercury was the truth. And that was the slogan of the day. A night with Venus, a lifetime with Mercury. 200,000 soldiers. Now add the ones who go home and pass it on to others and others and others. Cause of the disease of the Civil War: lack of sanitation, cross-contamination, typhoid, dysentery, poor quality of food, lack of food, improper cooking, chronic stomach issues, and scurvy was an issue. Lack of clean water, dysentery. Population previously untouched by many of the diseases. These farm boys get into the Army and gather with all these other farm boys and all these other guys from the cities and everything, and they have no immunity whatsoever to measles, mumps, etc. And they catch it, and some die. Opportunities for harmful behavior. I very carefully worded that one. That's the alcoholism and the STDs. I should also include snowball fights in the Army during the winter. There were actually soldiers killed in snowball fights. I mean, they fought it out. Different environment. Many of the 30,000 of McClellan's forces on the Virginia Peninsula caught malaria from the swamps, from the mosquitoes. They said it was miasma, bad air. It's mosquitoes. All of these occurred at the field and camp and in POW camps where extreme cases of malnutrition and disease were found. The POW camps, many of us know about Andersonville. Many of us know about Libby Prison. Quite frankly, the Union POW camps were almost as bad, if not as bad. There was a camp in Rock Island, Illinois. I had a church out near there. And it's Rock Island Arsenal now. And the Union guards would shoot the Confederate prisoners just for target practice. Physical treatments included bleeding at the beginning, enemas, plasters. Anybody here ever have a plaster, a poultice, a plaster? It kind of disappeared, thankfully. But it was still in force. I know my parents had them. One positive was the idea of proper air circulation and cleanliness is found in hospitals of the later years. Did it again. And this is a perfect example of an 1864 hospital. The high ceilings, the windows, very, very clean. One advancement beyond the fresh air circulation was the segregation by disease for the wards, thus preventing cross-contamination. The Union Hospital in Madison, Indiana is credited with this innovation. They put separate diseases in separate wards, and the wards were all shotgun houses, if you know what a shotgun house is. Many of those houses are still standing today and are lived in. The surgical building is still standing also. Now I have to include this. I could do an entire talk on the influence of the female nurse. It went a long way in regard to cleanliness and care for the wounded and the sick. And morale also greatly improved with the female nurses. Now, the head nurse was Dorothea Dix. Dorothea Dix was an interesting woman. I think ultimately she was a very, very unhappy woman. And she took it out on her nurses. And she took it out on the doctors. And she took it out on anybody who would listen to her. She required that nurses must be older, matronly, and for lack of a better term, very plain looking. I've seen pictures of a lot of the nurses. They fit the description. Personally, when I'm in the hospital, I'd rather have a pretty nurse. Always made me feel better. Pharmacology. That is a set. Every brigade or division hospital had a pharmacy wagon and at least one hospital steward who acted as a druggist. And yes, they were trained. Now, these are the drugs carried in the pharmacy wagon. The ones with asterisks are still in use today in some way or another. I don't know if silver nitrate still treats babies when they're born with their eyes or not. I don't know if that's still in use. But I know it's used for other things. Bismuth, camphor, valerian, quinine, ginger, magnesium sulfate. I put a question mark behind castor oil. I really hope castor oil still isn't used. Really. And potassium iodide. That is still used once in a while. But look at the ones that are no longer used. One is called blue mass, calomel and mercury, and calomel is actually a mixture with mercury and other things. Highly toxic. Arsenic acid. Really? Asafoetida, which is a combination of not nice things. Spanish fly. Creosote, internally. Atropine is still used today. Copper sulfate, poisonous. Hemlock. One of those Greek philosophers died from drinking hemlock. Socrates, thank you. I always get Plato, Socrates, and Aristotle mixed up, which is why I got a D in Intro to Philosophy in college. Ergot. What's ergot? Anybody know?
Hallucinogen?
Hallucinogenic. It's basically the fungus of rye and barley. It is probably the cause of the witchcraft trials in Salem. Ergot poisoning. Henbane, poisonous. Strychnine, poisonous. Mercury chloride, okay, that's great. Iron iodine syrup and regular iodine, all internal. Internal. Turpentine, internal. Opium. Lead acetate. Somewhere I learned something about lead poisoning. So they're using lead acetate internally. All of the ones I mentioned are considered toxic today. Case study, the Spangler Farm. Spangler Farm, and one of the books that I have over there on the table is entitled Too Much for Human Endurance, and it's about the Spangler Farm. July 1st through August 7th, 1863. Hospitals for the 11th Corps and the 2nd Corps, both of which got really battered in the Battle of Gettysburg, horribly battered. Number treated on the property, somewhere between 2,500 and 3,000. All of those wounded came into there in the first 4 or 5 days. Deaths, which I find to be an amazing figure, 180. That's all. Doing the math, that is 6%. The surgeons at Spangler Farm knew what they were doing. They did an incredible job there. Consider 2,500 to 3,000 wounded, and you only lose 180? 3 famous ones: Brigadier General Francis Barlow, Union. Political general, and I have to say that because he really blew it at the Battle of Gettysburg. He was part of the 11th Corps, and the 11th Corps was lined up on day 1, and he decided he wanted to go out further. So he goes out beyond the 11th Corps line with his division, and it forms a salient, which means the Confederates attacked on 3 sides. They took horrible wounds. He blamed it on the German soldiers who ran. It was Barlow's own fault that he put the men into that position. Barlow is severely wounded. General John B. Gordon, one of the Confederate generals, sees him, has his men move him under the shade of a tree. That witness tree is still standing. It's one of the few still left on the battlefield. And Gordon rides off, thinking that Barlow's going to be dead. He has a severe wound. He's partially paralyzed. He's going to be dead. Well, Barlow is taken to a home in Gettysburg where he's treated. The bullet is removed. And his wife, who's older than he is and is a nurse, finds him, gets a pass to go through the Confederate lines, finds him, and winds up, after the Confederates leave, he winds up at the Spangler Farm. He's treated, he eventually goes home. Brigadier General Lowe Armistead, Confederate. Armistead is wounded at Pickett's charge. He is the only general that made it over the Union line. He is shot, resting his arm on a cannon. He is shot. It was not thought to be a mortal wound. He is placed in the spring house at the Spangler Farm. The other person in the spring house, who was also a celebrity, was Harriet Beecher Stowe's son, who was wounded. He survives the war. And of course, Harriet Beecher Stowe wrote Uncle Tom's Cabin. And as Lincoln said, you're that little lady that started all of this. Armistead dies on July 5th, 2 days later. The wounds, again, were not considered to be mortal. From what the descriptions of the witnesses are, is that he probably had a pulmonary embolism and died. That he shouldn't have died, but there's no way they could do anything with a pulmonary embolism. Then there's Captain Augustus Vignos. I love that name. He's wounded at the Spangler Farm. And Rebecca Pennepacker Price. Any of you from the Philadelphia area? Pennepacker is a big name in Montgomery County outside of Philadelphia. Huge name. Well, she decides, she's just Rebecca Pennepacker at the time, she's going to come be a nurse, and she doesn't care what Dorothea Dix says, she's going to volunteer. She shows up, and Augustus Vignos is one of the ones that she treats. Now, everybody thinks he's going to die. He's had his surgery, but everybody thinks he's going to die. And she says, no one's going to die on my shift. And she makes sure he's fed, is taken care of, is cleaned, just taken care of. he survives. 15 years after the battle, Captain Vignos gets a letter from Rebecca Pennypacker Price saying, "I'm just checking up on one of my boys." They got together in kind of a reunion for the next 20 years. It's just kind of one of those neat human interest stories of what can happen. Time does not allow for the work of the Christian Commission or the Sanitary Commission, or the incredible care from so many in Gettysburg who opened their buildings, churches, schools, and homes to the wounded. 87 buildings is the count now that housed wounded in Gettysburg. I did a talk on civilians in Gettysburg at a couple different places, and one of the women, her husband was the postmaster, and he took off. He got out of town. He was getting out of there because he was afraid he'd be captured by the Confederates. He left. When he comes back home after the battle, his house has 9 wounded soldiers in it. And no one has ever written about her greeting to him when he came back, but I can't think that it was very friendly. But this was the case all over. Real quick story, Tilly Pierce was 15. She lived right in town, and actually the Tilly Pierce house is now a bed and breakfast. Tilly Pierce wrote many years later about her things that happened. And her mother wanted to get Tilly Pierce out of town because the Confederates had entered the town on July 1st, and she was worried about her. So the mother sent Tilly and an aunt out to one of the Wakerit farms, which happens to be behind Little Round Top. Day 2, of course, is Little Round Top, and the farm is used as a hospital. Tilly Pierce, who's 15, never, ever should have seen what she saw. I mean, just think, 15-year-old with all of that. This Union soldier who was with this one patient comes to her and says, "Will you come talk to my patient? Because he really wants to talk to somebody, and you look like you're about the same age as his daughter." Tilly goes to talk to this wounded officer. And they talk most of the day. And this is on July 3rd. And he makes her promise to come back in the morning. She comes back in the morning and he had died overnight. It was General Stephen Weed from New York, killed by a sniper that shot from Devil's Den to Little Round Top. Just a couple examples of what happened at Gettysburg. During the Civil War, medical personnel, including surgeons, gave their lives to save others, and many suffered for the rest of their lives from the strain. Letterman left the Army in 1864 after Surgeon General Hammond was cashiered because he wouldn't give up the idea of calomel. He said it was a toxin, you shouldn't use it, and they kept using it, and they cashiered Hammond. And Letterman left the Army. He wound up as a coroner in San Francisco in 1867. His wife died the next year of gastroenteritis, and he had many illnesses. He was a broken man at that point, and he died in the early 1870s from a plethora of conditions. His presentation is dedicated to all the medical personnel, Union and Confederate, who served during the war. Thank you.